Hi there. I'm out of the hospital and I wanted to give you an update on what's been going on, not just the last 3 days, but kind of this whole treatment scenario. A lot of you had questions about why I'm choosing this treatment after a whole summer of just wanting to live my life and not be touched by cancer and being so wholly committed to the fact that I want life to be quality and not quantity. But things have changed. And so I think we should have a little conversation about how that happens and the choices cancer patients make. Can you guys believe the call came on March 22nd, 2019? We are almost 7 years to the date. It's amazing to still be with you. Okay, so here's my patient history. Patient was diagnosed with breast cancer in 2019 after presenting with an axillary mass. Patient has been through multiple lines of treatments, including initial neoadjuvant dose-dense AC chemotherapy, which was aborted due to side effects. This just distills everything down to the very fine points, but erases all the human torture that goes on with cancer treatment sometimes. I'm also very, very susceptible to side effects, so please know that this is my story, not everybody's story, even with the exact same treatment. What they're not telling you is I was on morphine for 3 days, not able to swallow because of the mouth sores. I lost 19 pounds in 10 days. I had 106-degree fevers and ended up in the ER over and over again. And then my heart crashed while I was in the chemo chair and they had to haul me out in an ambulance. So that was the end of that. Patient developed metastatic cancer after that. I had a mastectomy. Then I had an axillary lymph node dissection, which means they take the main lymph node out as well as some of the surrounding ones. They did pathology, found out it was a 60% chance that it was probably in all of my lymph nodes at that point. So they went in through the same scar a week later. Radiation was fine until it wasn't. It made me tired, it was a little annoying, and then all of a sudden it was like third-degree burns all over my chest. She has been through multiple lines of medications, including tamoxifen, letrozole, ribociclib, Xeloda, which is capecitabine. You all have heard that before. So those are the drugs that I took over the summer, and those are the ones that were inhibiting any kind of activities that I wanted to do in my last possible summer on this earth. I have tumors in my abdomen, around my bowel loops. They are now starting to surround my gallbladder. I have cancer in my ovaries. We weren't sure if it was in my spine. I was told that if I hadn't done any kind of intervention that I was going to be gone by fall. So my biggest fear was death by bowel obstruction. Hospice in Haines, Alaska does not have the same sort of clinical credentialed staff as they do in the lower 48. And so basically it's a volunteer organization where they do your groceries or your house cleaning or read to you or beautiful things, but none of it is clinical. We had to come back for help. And then we came back to our house in New York. I said goodbye to my dearest friends and the home and the life that I had made over the course of 8 years in Haines, Alaska, and the new house that we had just built 2 years before. The thing is, when we got back to New York, my doctor was like, let's just do one more diagnostic test before we enter you into hospice here, just to make sure we're doing the right thing. So what we learned from that was that the medication I took over the summer actually had an impact. We didn't think it did. It surprised the heck out of everyone. It didn't stabilize my cancer. It stopped my tumor markers from rising so quickly. So clearly it was having an impact. And it meant that it was something that maybe we should revisit. I was no longer in a place where I cared if I was kayaking or holding my camera. I mean, I'm here for the winter. It seemed like the perfect time to try something again. The problem is then I had a different set of side effects. I had brain swelling and I went into this manic obsession state for 2 days. It just was unending and Tim could not reason with me to save my soul. So that we had to stop those meds. I went to Alaska for a little while to visit friends that I thought I'd never see again. And that was such precious time. When I came back, I just felt like I was waiting to die and I didn't know what was going to happen next until we got this genetic test back. It was something my doctor wanted to try. She thought maybe we'd find another way in. Early genetic testing showed that I am estrogen and progesterone positive, which means that that's what's feeding my cancer and that's what we've been treating for. But now I have this overexpression of the HER2 gene, and that means I'm eligible for a medication that it's called Enhertu, and it has astounding results. Unlike regular chemotherapy, you don't do this for a specified period of time. It's not finite. You do this for the rest of your life, and it's every 3 weeks. The average life extension ends up being 2 years, but that's if they do it for the rest of their life every 3 weeks. There are so many ifs about this treatment. We don't know if I'm going to tolerate it well. We don't know if it's actually going to even have an impact. We don't know if I can continue this in Alaska if I want to go back, which I really want to go back. So since this has the potential to make me really ill, as all the other treatments have, I've had to really consider what are my goals here. Yes, I want to avoid death by bowel obstruction. I don't know if I can do that, but what I do know is that day to day, my function has decreased significantly because of the back pain that I have. With the fluid that is building up in my abdomen around all the cancer, it is pushing pressure on my spine, and all the things I used to be able to do, I really don't do so well. I don't want to have to be cared for in that way. I would still like to be very mobile as much as possible. And I think that's, for me, what this all boiled down to. Taking it from the point of what do I want to do with the rest of my life, my biggest thing right now is getting back to Alaska to see the hooligan run with Tim. So the hooligan run is when a 6-inch smelt type fish come right past the inlet in front of our house, up a river and into a lake. And they're followed by humpback whales and droves of sea lions, seagulls, eagles, like everything comes. And it lasts from anywhere between just a few days to up to like 10. Happens once a year. I've seen it twice. He's never seen it. That's at the end of April. I think I can get in 2 infusions before we leave. We go, we fly, see what we want to see, and either I stay and we arrange for these kinds of treatments to continue in Alaska, which requires a 4-hour ferry ride to the Bartlett Hospital in Juneau, and overnight to have my infusions, to stay overnight again, to then catch a ferry ride back. So this is not an easy thing. Or I come back here and have some more. And that's if I can tolerate it. Obviously, I keep saying that. So none of this is anything we can bank on. I literally have stopped making plans other than we have one goal. So that's where we're moving from. But given my reaction to these meds and how badly my cancer gets beat every time I get beat down, even if we just get a few of these infusions in, it could buy me that extra summer that I never in a million years thought I was going to have. So now that you're all caught up, this is the story of going forward with this new treatment, how that's going, the complications that we've hit, and what that might mean for me. The first thing on the list is to get an echocardiogram to make sure my heart's okay before we start this targeted therapy. This is an easy test, so I came by myself. And Tim is recovering from his full knee replacement. The weather right now is ridiculous. When I left, it was not like this. Well, I made it, and I sent a note to Tim, and he sent me these dog pictures in return. In the end, we learned I do have a heart, and I am good to go. So today is a 3-hour series of infusions, 20 minutes for anti-nausea meds, 20 minutes for steroids, and 90 minutes for my Enhertu. Nurse Tanya was so kind with the IV. Oh my gosh, with the heat pads and opening the door so that I could see Tim. Even when I couldn't see him, he was sending me sweet texts. I tried to send them back, but I only had one hand. I was fine with the anti-nausea and the steroids, but then it came the time for Enhertu, and they gave me a little bell just in case I had any kind of distress. I did get really scared at one point. They had to clean the line before delivering the Enhertu because it can't touch saline. And the dextrose that they used to clean the lines burned my veins so bad. I was so afraid that the Enhertu was going to hurt even worse. But they ripped that line out of me and put the dextrose into the trash, and then the Enhertu was fine. Day 2 was simple: hydration and a new Lasta shot. Red. It's got to be the steroids. So I have to talk about my husband and his genius here for a second. I always have trouble being stuck for the IV, and it did take 2 tries yesterday, even though the nurse was fabulous and we did hot packs and all the things, right? But Tim was like, is there a way you can ask to have the IV left in? genius man. They even asked, did your doctor recommend this?
Well, I do play a doctor on TV.
So they got approval and they said yes. And so I have my IV all ready to go for today. I was really feeling hopeful for this medication. Aside from some chemobrain, which I'm familiar with, even though it's been a long time, I really felt pretty good. I was loaded up with anti-nausea and steroids. I was fatigued, but I was also like jitzing, like being given the steroid effect. Aside from trying to like balance that out, everything was okay. We just relaxed and tried to kind of ease into this new state of being. The second day, we started out with pancakes with syrup from our friend Stephanie and watching TV, and then had to call 911. I went from an anticipated headache with Enhertu, because that's a known side effect, to having cognitive failures. It wasn't like I just couldn't reach for words. The words were just gone. We have 4 windows around our bedroom, and I would look out one and then look out the next, and the signal was not transferring to my brain in real time. I would just go blank and stop talking. And so we called my nurse practitioner. She immediately said, call 911 and get in for a brain scan. Hoax Corners Fire and Ambulance arrived on the scene, and my ride or die Mitch, he was with me the whole way. This is not our first rodeo. Greg was there timing my headaches and the spikes of them, and then giving me words when I lost them. And Alex was instrumental in getting me from my house into the rig. I was treated for an intractable headache and aphasia. Tim was my touchstone while I got this new IV. I've already had infusions for 2 days, and my veins are such crap. I can only use one arm because the other has had the mastectomy. Tim was so good about distracting me from the needles going up my arms, and also arranging dog care. So thank you, Audra, for taking care of our kids. I knew my white blood cell count was going to be high because of the Neulasta. It's designed to do that on purpose. It stimulates your bone marrow. But apparently, bandemia and leukocyte counts are also a problem with infection, and they didn't think that that was a product of the Neulasta. Suddenly, everything blew up, where they cleared my urine, and then they looked for any kind of skin infection. They did a chest x-ray. And then the only thing that they couldn't rule out was meningitis. Tim went to bat for me not to get a spinal tap, but they kept insisting. I was told that it would feel like an epidural. They would have a needle that went into a 3-millimeter space to try to get this sample of fluid. They also did warn me that a lot of times it's not successful. What they didn't warn me about was the pain involved. I mean, we started out, the doctor's feeling on my back. She's trying to figure out between L3 and L4 where she's going to go in. It's tickling me. I'm giggling. I'm laughing about, did I wear the black underwear or the tan today? So I had 2 students in the room. I'm always willing to have students come in the room. How else are people going to learn? They took one of the hospital tables that goes over the bed, and they took my coat and they folded it and put it on top, put a towel over the coat. And this was supposed to be my comfort as I put my head like this. My coat was full of mud from our Jeep. She said, bend your spine like you're doing cat-cow, just arch it toward me. When that first needle went in to give me just the lidocaine, pinch and a burn, pinch and a burn. This was no pinch and a burn. This was fire. She did a second one, and I could still feel her fingers on my back. When I told her that, she gave me a 3rd injection, which also burned. All of these are burning. None of them are taking away the pain. And then she goes in, even though I tell her I can still feel everything. Now I've got the student sitting in front of me. I'm like this. She's got my hands, and she's telling me how brave I am and how this is one of the most painful procedures if the nerve block doesn't work. Now they tell me this, and I'm being told I'm brave? Are you kidding me? I am held prisoner with a needle in my back, being told not to move. I was screaming and crying and telling her she better get this sample or get the hell out. It was horrible. It was absolutely horrible. Somebody on here said that shouldn't have hurt. It should have been a small gauge needle. I looked up the notes. It was a 20 gauge needle. That was no small needle. And they went in between L4 and L5. I am like L4 to L6 deterioration. I'm just, Tim is so pissed. Tim is so pissed. My body was trembling so hard for 45 minutes. I was just like this. And Tim just came over and rested his head and just held my hands until I calmed down. A doctor that discharged me, I wrangled him in and said, "What the heck happened?" I was told that if I was able to feel her touching my back, she should have never gone through with this. And she did it anyway. And she got no sample. Turns out it wasn't meningitis. That's why a brain MRI was ordered upon my arrival. And that would have spared me all of this. My team, not the hospital team, because we can't necessarily know if there are cancer cells in the spinal fluid. It would have been nice to know that. But at that point, it was irrelevant. I opted not to get a port because I don't know if this medication is going to work, and I didn't want a procedure to install it and then another to uninstall it without knowing where we're going with this. That means this poor arm gets all the abuse. For the past 7 years, it's the only place that they've been able to draw blood from to place IVs. And all of my veins are decimated from chemotherapy, but also super scarred from all that time. By now, the needle pokes are racking up. I've had 2 tries for an IV from the infusions. I've had 2 tries for an IV in the ER. Now I've got to have cultures drawn from not the IV site. And one vein gives out, and then they've got to put another hole in. All of this on top of having 4 needles just put in my back. I am just so grateful that I had the best ER nurse. Yvette couldn't have taken better care. She brought Tim an ice pack for his knee. She made sure I knew what was happening.
You're taking a picture? Yeah. Then you're getting ampicillin.
I sent Tim home just after midnight, and I was about to head to a brain CT. I just want to quickly thank Josh and all the other sweet people who transported me back and forth down these hallways, and to Maddie, who always welcomed me into her CT suite with the utmost friendliness. I first met her for the brain CT, but then I went back to see her once more for an abdominal CT. Back again. I asked if she did MRIs, and she said that's too much commitment for her. Yvette kept me hydrated throughout the night, getting my blood pressure from 77/45 up to something a little bit more respectable in the 80s. And every time she did, she'd knock, ask if she could come in, and then turn on the lights. It was such a pleasant distinction from my other nurse. At 1 a.m., I finally got my brain MRI. That was the loudest but most amazing 40 minutes of peace I'd had all night long. I've not had a brain scan in, it's been years. So to have had that and to know that my cognitive issues were not being caused by a tumor, all of that got ruled out. I don't know why St. Peter's has no pillows in their ER, but Yvette found a set of sheets and wrapped them in another set. She also gave me a blanket to use as lower lumbar support. And when I finally did get to sleep for like an hour, I woke up with thrush so thick on my tongue. So Yvette brought me these spongy swabs and a glass of water, which it was nice to be able to peel the paste off. So forever grateful to Yvette. Between breakfast and lunch, which were saltless but otherwise delicious, I had a visit from 2 different doctors. One was infectious diseases. They wanted to take me off antibiotics and then have me stay overnight to make sure that my countenance didn't plummet. Was really hoping I'd get out that day. And then I had the neurologist come by. My lights are low because of my headache. He comes in, flips on the lights, doesn't even look at me, tells me to raise my arms in front of my face and to hold them there because we're still doing stroke testing. This has been going on all night long. I have a tray table across me. I can't bend my arm because every time I do, I set off the IV machine. It stops the flow. I can't push with my other arm because I've got the EKG spaghetti all around me. I looked at him and I said, "This is easier said than done." And then he turns around and looks at me. Like, dude, It's like, how do you walk into someone's room and not even bother to make eye contact and like assess the situation before you ask somebody to perform something? After 20 hours in the ER, I finally got a room, and my escort was my pal Josh. Although it was a little too bright, it was really nice to have daylight. I was so excited to have a bed that I could adjust by myself and a pillow. Well, unlike the ER, I get to walk myself to the bathroom. Last time I had to beg to be disconnected from all the medical spaghetti. It was so nice to see Tim had a space that he could just prop his feet up and roll himself to me and have some ice on his knee. Perfect.
Permission to come aboard?
And then my dinner came and everything felt so civilized and so much more comfortable.
Oh,
Thank
you. Are
you.
so kind.
You're welcome.
Thank you.
Maybe brought salt.
I snuck it in.
Suck it in. He brought my herbal tea too. Baby. My hospital nurses were amazing. Candace, Cassandra, and Kylie. I could not have made it through the night without them. We had several issues. One, my IV had finally had it. Every time I bent my arm, I was having issues with the flow, and then it finally just started leaking all over my bed. They had to put in a second IV, which was really distressing to me. And they had to bring in the ultrasound machine and guide the needle through. But I was just at the point where between that and being in so much pain from the lumbar puncture, pain always gets worse at night. I was not doing okay. I don't know where to put my legs or to put my back to make this pain stop. I can't get into any comfortable position. And I never ring a call button unless I absolutely have to, especially as a former flight attendant. But I had to. I had to ask for the morphine that had been prescribed earlier that I refused then. But at that point, I really, really needed it. When I was admitted into the hospital, of course, they always ask the usual questions. Do you have a healthcare proxy? Do you have an end-of-life directive? Which we had filled out when I was in Alaska because we had to travel across the country, and that's the last thing I wanted to be caught without. So we had finalized it before we came. The problem is New York State forms are different than the Alaska forms. So now, while I'm not actively dying, one of the things that was beneficial of having these items filled out in the hospital is that I would have had somebody to not only talk me through the options, but also bear witness to my signature. I had opted for comfort care in the end. I have DNR orders in place. The only thing that I wanted were things that were going to make my passing easier. So the difference between the Alaska form and the New York form in terms of comfort care is that the use of an oxygen mask is not considered just comfort care. It was actually in the category that had greater interventions. And so my nurse was fabulous. She went through some of these options with me. She really wanted me to talk to a practitioner about what all my choices were going to be and to do it in the daytime while I was coherent. It was not an emergency, but it was something that would have been nice to have been done. I can't even tell you how mad I am right now. When my back started throbbing because of that stupid lumbar puncture that proved nothing, they gave me morphine so that I could sleep. I haven't slept in like 30 some hours. And I finally get to sleep. And this guy barges in my room at 20 after 12. Just got delivered morphine, finally fell asleep. You show up in my room and you want me to understand what the heck we're talking about. Sign your name here, print your name here. Military time, military time. I'm like, I don't know what date it is. I just opened my eyes to the lights flying on. He comes in here upset because the paperwork doesn't have my name label on it. It's a form. I'm supposed to sign it. And he's like, well, how am I supposed to do this if I don't have a pen? How are you a doctor and you don't carry a pen? He was supposed to go through it with me and to show me what wasn't translating the same way on the paperwork. That's not what he did. Sign your name here. He's already got it pre-filled out for me. The nurse came in while he was here. She's like, what's going on? Do you know what you're signing? I'm like, I don't know. I don't care. I'm going to sign it because it's probably close enough. We can change it in the morning. I'm not dying right now. Of course, I leaned up on my side and my back started throbbing again, and I don't want more drugs. I can't sleep, and now it's like 10 to 1. Well, it was a long night. Sunrise was beautiful, and there was new hope on the horizon, along with a lot of detritus from my care throughout the night. It's now 7:30. My white blood cell count is still high. Once rounds start at 11, hopefully that means someone's coming around to release me. So let's hope. Breakfast has arrived. This food might actually taste delicious today. I'm going home. It's official. I'm being released. No more needles up my arms and holes in my hands. All I'm taking home is a bunch of bruises and bandages, but yay, I'm free. No more leash. I'm gonna go meet him. Oh, my face is like super puffy from the steroids still. And I mean, they started on Thursday. I got more on Saturday, Sunday, and then Monday before I left the hospital. So it has been a lot. So the good news in all of this is that we can probably continue with a drug that honestly, if we lower the dose a little bit more, this is what my oncologist is saying, or as some of you suggested, instead of Neulasta being injected all at once, a 4-day supply, we could break it up over 4 days. And we're not going to even talk about this for another week. She's like, stay home, heal. This infusion's every 3 weeks. We've got time to deal. We're going to do tumor markers in a week. They were climbing so fast. Even if they just slow their rate with this, that could be a really, really good sign. And honestly, I thought I was going to be so nauseous after the fiasco that happened in Juneau, where I was hospitalized for nausea and then given anti-nausea that sent me into convulsions. I was so afraid of all of that. If anything happens where I have these super high blood cell counts, we know it's medication related and not infection. It's just going to be how I react. This channel started because I threw a video out to family and friends because I was so tired of making phone calls saying that the cancer was back and that the drugs were no longer working. And I thought I was done for. And I said all my goodbyes, and my whole channel was all about that, right? I didn't think I'd ever want to go through this again. Somebody even called me a liar for it, which I've got all the receipts. So you come at me, honey, I'm coming right back for you. You know, somebody had written to me, I wish I could remember who, your brother had gone back and forth on meds and then not meds. And we had this beautiful conversation about what it's like to find out that there's this option, you take it, it's horrible, and then you don't ever want to do it again. And then there's another option, and you take it, and it's horrible, and you never want to do it again. And then there's another option, and you take it, and it is this spiral that just builds on itself, and it keeps going up, 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 until you get to this point where hope is offered again, and then suddenly there's actual hope. And I felt like that's what was happening here. I wasn't sick. I wasn't nauseous. I had some headache and some brain swelling, yes, but that was something that could be controlled. It wasn't an outside source. It is strictly the medication. Thank you all for all of those kinds of conversations, because as much as it hurt my head so bad to just even be reading, I was when I could. And so thank you for being there with me. Thank you to my dear friends in New York who were with me in the New York hours, Gail and Marilyn for talking on the phone when I was in the ER, and to my Alaska friends who kept me going through the night. So Anne and Dina, thank you so much for your conversations. Thank you, Lisa, for making Tim's favorite meal and my favorite salad. It was so nice to come home and not have to think about that. Thank you, Karen, for offering to come visit, although my immune system was compromised and it probably wasn't a good idea to have any visitors, so I'm sorry about that. I also got countless direct messages and notes, so thank you to Tom, Karen, Jeanette, Vanessa, Gail, Kathleen, Leah, Matthew, Terry, Marty, Rose, Debbie, Kate, Joan, Wendy, Jessica, Virginia, Kat, Leva, Laura, Bobby, Amy, Rosemary, Teresa, Richie, Bruce, Marlena, Edie, Colleen, Barbara, Beth Ann, Greg, Deb, Tammy, Mary, Dan, Maureen, Carol, Tiffany, Betsy, Mark, and Audrey. Thank you, my love, because I know how much pain you're in, and I know how hard it's been to get in the car and come to the hospital and to sit with me. And thank goodness they had that recliner in the room, and they brought you ice, and we just got to sit in silence and just let both of our nervous systems come down together. And now we get to do it at home. Look at you go.
Getting ready to flip.
Thank you, Stephanie. Thank you, Tim.
Thank you, baby.
Okay, now I'm really leaving. Now the dog really wants to go out. So I love you guys, and I'll talk to you soon.